It's something no parent ever wants to see their child go through: fighting cancer. Today is International Childhood Cancer Day, and we're checking in on research developments and how we can help support the fight. Let's welcome Dr. Jacqueline Kraveka, Associate Professor of Pediatrics at MUSC Children's Hospital. Thank you so much for joining us.
Thank you for having me.
So we're hearing that there is a bit of an uptick in the number of young patients who are being diagnosed with cancer. Why is this?
Yes, there has. I mean, recently there was a slight increase reported in the incidence of childhood cancer, and seems to be in younger children. And we don't know the exact cause, but it may be perhaps due to environmental effects. And we've made great strides since the 1950s, the treatment of childhood cancer, where survival was really less than 10% in the 50s and maybe the 30s, 1970s, to over 80% of children being cured nowadays. But one thing that a lot of people don't realize is that death from cancer is still the leading cause of death in children from disease, more than all other diseases combined, and only second if you look overall to accidents. So we've made a lot of progress, but we still unfortunately lose a lot of children to the diagnosis of cancer.
What are some of the most common cancers among children?
So the most common cancer is leukemia, and then after that are brain tumors and solid tumors and muscle tumors as well. Where we can cure almost 85% of leukemias. Despite that, because we see much more leukemia, it's still one of the leading causes. The leading cause of death are really from brain tumors in children and also from leukemias as well.
And what you just explained to us is that we've seen great strides in research and treatment just since the 1970s until today, with children living longer after their diagnosis. Can you give us an update on what research and new treatments that are out there that are contributing to just better outcomes for these children?
So what's been, I think, really exciting, as we've sequenced the human genome, we've been able to identify specific targets and specific abnormalities for which we have medicines that we can treat specifically. So we're moving into an exciting age of precision medicine where we can actually treat the tumor, both either leukemia or solid tumor, even brain tumors, based on the genes that are abnormal. So that certainly helped quite a bit. Bone marrow transplantation, and then one of the things that you hear a lot about are perhaps immunotherapy, whereas immunotherapies that we use a lot in adults aren't as effective in children. One of the therapies is something called CAR T cells or chimeric T cell therapy, where we actually take the patient's immune system and modify those immune cells so they can recognize the cancer. And that's an approach that's been very successful in leukemia and is now being applied to lymphomas, which is a cancer in lymph nodes, and also the solid tumors. And one of the exciting things at MUSC is that we're the only pediatric bone marrow transplant center in the state, and we are able to offer CAR T cell therapies for children. We have an initiative where we're sequencing all the pediatric solid tumors at diagnosis so that we can learn more and come back with more effective treatments.
That's incredible.
One of the things so it's really exciting.
It really is. Well, and I was going to say, though, that what it takes to conduct this research and to get those treatments out there is with the help of the community. And there are ways in which we can raise money for cancer treatment in children. And St. Baldrick's Foundation is a fantastic organization that raises money. And they've got an event coming up next month. Can you tell us more?
It really is. They have an event coming up on March 20th called Low Country Bald. And St. Baldrick's is a nonprofit organization that's actually been the largest source of funding outside of the federal government. And it's really only through research that we can really find better treatments that have less side effects. Yeah. And of the budget of the National Cancer Institute, only 4% of that budget goes to childhood cancer research. So it's really only a very, very small amount that's dedicated to childhood cancer research. And if we have more funding, then we can study it more, we can develop better treatments and treatments that have less side effects.
Absolutely.
As well.
Dr. Jackie, well, you're doing tremendous work at MUSC. I want to thank you so much for joining us today.
Well, thank you so much for having me. I really appreciate it.
We're back in 2 minutes.